Alright, thank you for joining my channel. My name is Mr. Jake. Today we are going to do AET reading part A, test 2. We've done previous test, which is test 1. If you're a new member, I will encourage you to look for the previous one and watch. Also remember and share the links. Help my channel to grow. Thank you. We can start now. Alright, so welcome to OET reading practice 2. We have 4 texts. We are always going to have 4 texts for our readings, okay? So in the 4 text, you need to master yourself, then you can locate your answer easily. Today is for cross matching. Let's move to the board. We have text A, text B, text C, and text D. So guys, our practice test 2 is about tetanus, and we have 4 texts. We are going to study the text and use the information in the text to answer the questions that follows. Okay, we have 20 questions, but we are going to answer only 6 questions under cross matching. So just like we applied the other time, you need to familiarize yourself with the text so you can locate the answers easily. Let's go to text A. Text A. Tetanus is a severe disease that can result in a serious illness and death. Tetanus, sometimes called lockjaw, is a disease caused by the bacteria Clostridium tetani. Early symptoms of tetanus include, then these are the symptoms. A person may have a fever and sometimes develop abnormal heart rate. Complications include, so we are talking about complications. These are the complications. There's no specific test. There's no specific diagnosis laboratory test. Diagnosis is made clinically. This particular test is useful. So we have test. So now, upon reading this quickly or skimming, you can do your scanning now. Things that you need to note down. This is about introduction. This first sentences about introduction. The second one is about symptoms. The third one is about complications. And then here is about test. Okay, clinical test. Or all right. So we can label this text as introduction to tetanus, signs and symptoms, and test or complications as well. Text B, tetanus risks. So it has heading and it is making it very easy for us to understand. Okay, tetanus is an acute disease induced by the toxin tetanus bacilli. Okay, a tetanus prone wound is, so these are the prone wounds. Intravenous drug users are at greater risk of tetanus. Immunosuppressive patients may not be adequately protected against tetanus despite having been fully immunized. So, in short, we can see that the entire text is about risks, people who can really suffer tetanus, okay, or conditions that can make you suffer tetanus. So the text is about risks. Text C, tetanus immunization following injuries. Thorough cleaning of the wound is essential irrespective of the immunization history of the patient, and appropriate antibiotics should be prescribed. So we can see immunization status, clean wound, tetanus prone wound. So we have the vaccine for the clean wound, vaccine for prone wound, okay? And we can see over here, we have information, fully immunized, not required, here to not required, and then primary immunization complete or booster dose, boosters incomplete but up to date, not required, not required. Primary immunization incomplete or boosters up not up to date. Reinforcing dose and further doses to complete recommended schedule. Reinforcing dose and further doses to complete recommended schedule. Yes. So yes. guys, everything I'm trying to do here is just to tell you, you don't have time to read all, okay? But you can see some information which are very crucial, not required, not required, not required, not required. Yes, reinforcing those. So in short, this text is serving as a treatment guideline. It is advising you what to do when you have clean wound and tetanus prone wound. Okay, so it is a treatment guidelines. Text D is about human tetanus immunoglobulin. Indications, dose, we have prevention dose, treatment dose, contraindications, adverse reactions. So every healthcare professional at this point is expected to know that we are talking about a particular injection or treatment or medication. Okay, so we are talking about a particular medication. In your questions, when you see anything about a particular medications, you can rush to this text. All right, now that we know our text, guys, we can begin to solve the questions. We have questions 1 to 6. For each question 1 to 6, decide which text A, B, C, or D the information comes from. You may use any letter more than once. All right, in which text can you find information about? Question number 1, the type of injuries that may lead to tetanus. All right, friends, let's understand the question carefully. We are asking about any injury, okay, or types of injuries that may lead over here means risks, okay, or prone to tetanus. All right, we know our text already. So text B contains tetanus risks, okay, and the type of wounds or injuries that may lead to tetanus are the following over here. Question number 2, signs that a patient may have tetanus. So the question is about signs. We go to the text which contains signs or symptoms. Early symptoms of tetanus include, so all these are the early symptoms, okay, also known as signs. So text A. Question number 3, how to decide whether a tetanus vaccine is necessary. So look at the question carefully. How to decide. Okay, so it's about treatment guidelines, which will help you to decide. Okay, guideline will help you to decide. So we go to the text that contains treatment guideline. So we have vaccine, we have clean wound, we have tetanus prone wound, and vaccine. We can see not required, not required, not required, not required. Reinforcing dose and further doses to complete the recommended schedule. Reinforcing dose and further doses to complete the recommended schedule. So these are helping you, okay, when you have the information over here. When patient is fully immunized, not required. Primary immunization complete, boosters incomplete but up to date, not required, not required. Primary immunization incomplete or boosters not up to date, reinforcing dose and further doses. So this is guiding you to helping you. It will help you to decide, okay, when to give the injection HTIG. Question number 4, an alternative name for tetanus. All right, let's understand the question carefully. An alternative name for tetanus. So we are focusing on tetanus, okay, as a condition. So we go to the text that contains more information about tetanus and we look for the alternative name. So I assume we don't know the answer, so we are looking for it. Tetanus is a severe disease that can result in serious illness and death. Tetanus vaccination protects against the disease. Tetanus, into brackets, sometimes called lockjaw. So this is an alternative name, sometimes called lockjaw. Question number 5. Possible side effects of a particular tetanus medication. So what are we looking for? Possible side effects. But we are focusing on what? A particular tetanus medication. So we go to the text that contains a particular tetanus medication or drug. Okay. So we are in the text which contains a particular medication. Okay. So HTIG medication. And we're looking for the side effects. In the question, we are looking for possible side effects. So we come to adverse reactions. And you can see local pain, erythema, induration. We have general, we have paresthesia, hypotonic, hyporesponsive episode. We have persistent crying. Okay, those are the side effects. Last question, number 6. Other conditions which are associated with tetanus. So let's understand the question carefully. It's very crucial. If you talk about other conditions, it means conditions which comes as a result of tetanus. Okay, they are which are associated with tetanus. So it happens as a result of tetanus. So in other words, it can be in a form of complications. So we go to where tetanus is, we look for complications. So when we use complications as a guide, we can read from the start of the sentence. A person may have a fever and sometimes develop abnormal heart rhythms. Okay, so what are we saying now? Sometimes develop abnormal heart rhythms. So these are some of the conditions the person can develop or are associated with tetanus. Alright guys, thank you for staying with me and watching the video to the end. Press on the like button and expect the next video. Bye bye, my name is Mr. Jake.